and this is actually the first episode in Asking Nurse Vicky. And in this episode is just to focus on talking about health concerns, anything that can help to improve your overall health. And I'm doing this for Petra Home Care, which is an home care agency that service the Houston area. We provide caregiver services, transportation, and things like that. So in this very first episode, I will be talking about different types of health insurance. So probably you yourself, you have one type of health plan or another. So I'm going to be sharing about different types of health insurance. And in this particular episode, I am going to focus on only one. But let me share my screen with you so you can have an idea of what I am talking about. Different types of health care insurance. Here I have about 5 that I'm going to go through. But in this one, I will only talk about one. And another episode, you can follow me for another type of health plan, because there are 5 basic ones or major ones that we'll be talking about. And if you have any question regarding any of these, you can actually send your question, your comment to info@Petra Home Care. So let's go right in. The first one, the big one, all right? And that is Medicare, all right? Medicare, it is a big insurance plan nationwide in the United States of America, all right? And it is an insurance that is funded by the federal government. That means it doesn't matter the state that you are in. I am in Texas. So if you are in New York, you are in Colorado, whichever state, you will have Medicare. And the same condition applies to that plan. It is the same across the board. So this insurance has 4 major parts. You have Medicare Part A, and the Medicare Part A covers your hospital stay. They call it the hospital insurance. That means if you go to the hospital, the A covers for that. There is still a copay, and your B covers for your doctor's offices, like your lab work, your equipment, and things like that. So if you need to see a doctor in the clinic, or a physician, a specialist, or anyone, that's going to go through your Part B. All right. So Part A, you get it automatically once you reach that age of 65 old and over, and you have earned enough credit to qualify. So these are based on qualifications. So anyone cannot just get it. Okay, number one, you have to be 65 years of age or older. That can change. And also, you must have worked for an employer and earned enough credit, to be able to get Medicare. And you must be a citizen or a legal resident of the United States. Okay, so those are the major 3 conditions. But in addition to that, not talking about age now, if someone has what we call an end-stage renal disease and is on maybe a kidney transplant list, things like that, that person will qualify for Medicare. Or a person that is receiving dialysis that is due to end stage. For renal disease, they have acute renal disease. That means there is a potential that your kidney will work again. But when the kidney doctor said this is end stage, that means it is chronic, there is no reversal, you will continue to require dialysis no matter your age. There you can qualify for Medicare. So Part C of Medicare is usually what we call the Medicare Advantage plan. Okay, and those are the insurance that you buy outside of Medicare, outside of the traditional Medicare, such as like United Healthcare, Medicare, Aetna Medicare, Blue Cross Medicare, AARP, Medicare, those are Medicare Advantage. That means instead of the federal paying directly for your healthcare services, they use them. So they become the gatekeeper monitoring your health and responsible for paying your bills. So the main thing with the Medicare Part C is that for traditional Medicare, that means if you have the regular traditional A Medicare and you have your B, which you actually have to pay a premium for, and the premium is based on your income, that would determine how much you pay. So if you have traditional A and B, that means you can use any doctor. You can go to any doctor. It doesn't matter, they are in network with Medicare. But if you have the Medicare plan that we call the Medicare C, you have to use a physician, a provider that is in network with that particular plan that you use. So maybe it's Humana, maybe it's United. You have to use a particular provider in their network. The only thing with the Medicare C is that they have some additional bonuses that they add to you. For example, your vision. Because of vision is not covered by A or B. It's separate from that. You pay out of pocket for that. For most Medicare Part C, the Advantage plans, they will pay for your vision. Some of them will pay for that and will pay for your dental. And then some other perks, maybe some massage here and there. Something, they have additional bonuses that they will offer. And it's different from one plan to another. So you do your homework if you want to go that route. And then Part B, that is your prescription. Okay, that is your prescription, and there are different levels, different tiers, depending on your medications. Okay, so Part D covers your medication, like your drugs. So if you're taking any medication that are very expensive, you want to check to make sure that these medications will fall under that tier 1, tier 2, or tier 3, because those will determine what your premium will be. So if you have any question, these are just like summary of Medicare, okay? Just summary of Medicare. Medicare has a lot of parts. You know, we talk about the hospital, the other thing that Medicare covers, if you go to a rehab, and if you go to like a nursing facility, or if you have like home health services, those things they cover for it. All right, but this is just a summary. If you have any question regarding Medicare, or you want to check if you qualify, if you can be on Medicare, you can send information to us, questions to us at info@Petra Home Care, info@Petra Home Care, and we will definitely respond to you. All right. So, but in another episode, we're going to be sharing more about other types of plans. As you can see here, we'll be sharing that with you. All right. So, info@Petra Home Care, and our phone number here is 713-320-9619. And you can also check us out on our webpage, www.petrahomecare.com. So thank you so much. This is Victoria, RN with Petra Home Care, and I cannot wait to hear from you. And watch out for another episode on Ask Nurse Vicky. Have a good one. God bless you, and have a good one. Bye-bye.